So hello to everyone. So my name is Bruno Quesson, I'm a PhD, so I'm working in the University of Bordeaux. And the talk of today is going to be MRI for guiding HIFU treatment. So if we consider the general objectives of the HIFU treatment is to, for example, treat a tumor non-invasively. For this, we want to sonicate and send energy from outside the body to the targeted tumor while trying to avoid producing damages on the surrounding healthy tissues. Since we want to induce temperature change, it's obvious that we would like to have a monitoring technique, an imaging technique that would allow to map ideally in real time and in 3D the temperature distribution in the tumor and in the surrounding healthy tissue. So the purpose of this talk is to use to try to convince you that MRI can achieve this and to present you methods how to monitor the temperature change using this technique. So basically MRI, for this you need to do MRI you need a magnet. So this is an example that you have here. And you acquire images through, not directly, but through the acquisition of the Fourier transform of the images, which is known as a K-space that is displayed in the bottom right of this slide. And the top right, you can see the acquisition sequence that show the timing of the events that are produced during an acquisition of MR image. And using these pulses, delay, and gradients, you can make a trajectory and acquire the data inside the K-space. And then by back Fourier transformation, you can retrieve the magnitude and phase images. The magnitude represents the quantity of protons that you have in each voxels, and the phase is related to the precession frequency of the entity you're imaging. Okay, so ideally, if we want to monitor the temperature change using MRI, we need to have methods that are sensitive to temperature change. Fortunately, there are a number of physical parameters that varies with temperature. For example, the diffusion coefficient of the water molecules, the longitudinal relaxation time T1, and the frequency of the water resonance. And also you can use a spectroscopy to do that. So this table shows you some advantages and drawbacks of each method. I'm not going to enter deeply into the details, and I'm going to focus this talk on this technique, which is called the PRF, the proton resonance frequency shift, and try to show you some examples and how it works. So what's the principle of that? As I said before, the proton resonance frequency of the water is changing linearly with temperature. But it's only valid for water, not for fat. So please keep in mind that we cannot monitor temperature change in fat using this technique. So basically what you want to do to monitor temperature change is to see a change in the phase image, because the phase is a map of the frequency distribution. And since this varies temperature, you can retrieve the temperature change. So you have here an example with magnitude images acquired before and after and during the sonication with HIFU, and you have the corresponding phase images, and you can clearly see in this image that you have a change in the contrast in the phase image. By subtracting these two images, you can retrieve a variation of a map of the variation of the phase, and then multiplying by the constant which depends on the echo time, you can retrieve the temperature change that you can code in color and superimpose to the magnitude image to know where you are hitting your sample. The advantage is that you can acquire this quite fast, and you need to process this in real time to provide information to the physician while you are doing the treatment. So this is an example of a movie that represents an experiment. In these experiments, you acquire dynamically images one after the other during HIFU sonications. And what you can see is that at the beginning, you have hitting, very focused hitting, and taking advantage of the thermal diffusion, the hitting expands in space, and you can map the temperature distribution during the sonication and after the sonication, while the tissue is cooling down. But you have to understand that there are some limitations or important parameters that you have to take into account about, and which mainly deals with the precision of the MR-thermometry. So the main point is that, in my point of view, is that the precision of the thermometry depends on the signal-to-noise ratio. To illustrate this, you can take two examples. On the left, you have a high signal-to-noise ratio, which means you have a high quantity of protons and you have a very long vector. Here, this magnetization is very long. And on the other case, you have much less signal, so you have a much smaller vector here in blue. Okay. However, the noise in both experiments is the same. Okay, so in fact, this for each measurement on both conditions, you have a certain probability to get this vector to be inside this cone, or in the second situation, inside this cone. Okay, but then since the length of the vector is much smaller in the case of a lower SNR, you get a much larger aperture of this cone, and then as a consequence, you have a much lower precision of the thermometry. So this means that when you are doing your experiments, you have first to define the acquisition sequence, and that gives you a sufficient SNR to have a reliable thermometry. In other words, you need to make a compromise on the acquisition sequence you are using. However, with the PRF technique, how does it work? Practically, you need to acquire images that are sensitive to the phase, to the frequency change, so to encode this information into the phase. So for this, you need to use gradient echo sequences. You cannot use spin echo sequences. The advantage of this method is that you can use rapid imaging methods. You can acquire images in a few milliseconds with modern imaging techniques. Which means that you can have a fast update on the temperature change. You can also do motion tracking. And you can use these methods on any clinical scanner, which is very interesting in terms of application for the patient. You can also do multi-slice imaging, which means that you can cover not only a slice, a region where you are focusing the energy, but you can also cover a volume of interest, for example, to verify that you're not overheating a region that is outside your targeted region for safety reasons. The other advantage of this technique is that intrinsically it uses very low energy deposition from the MR point of view itself. And since you're using repetitive acquisition for quite a long time, you need to ensure that your sequence itself is not going to make an overall heating of your patient. However, there are a number of drawbacks. This sequence is sensitive to artifacts. Any effects that will affect the spatial homogeneity. For example, if the shim of the magnet is not very good, if you have flow, motion, susceptibility that is related to changes with breathing, for example. I will show some example later on in this talk. This is going to induce artifacts on your thermometry that you need to correct for. As I said before, if you are trying to do MR-thermometry in a tissue that is full of fat, it's very difficult because this technique is not working in fatty tissue. For example, if we are thinking about breast application. The other point is that it has quite low sensitivity with temperature, so the frequency shift is only about 0.01 ppm per degree, which is quite low. But using standard sequences, you can still measure temperature change using this method. I want to make a focus on an important point is that with the PRF technique, you're not measuring the absolute temperature, but you're only measuring the temperature change in time. So it's only a relative measurement of the temperature. So how does it work? Then you need to have a magnet. You need to have a HIFU, which is MR compatible, of course. And you're going to collect images, magnitude and phase, dynamically, and repeat this during the treatment. So if you're able to acquire fast enough and compute the data in real time to avoid any latency between acquisition and display, then you're able to monitor in real time your treatment. So this is very important in terms of safety for the patient, but you can do this in a much more sophisticated way. I will show you one example at the end of this talk. You can use this in real time to make a feedback control. In other words, you can use the images, the information from the temperature images you're acquiring in real time to adjust dynamically the HIFU energy deposition you're producing with your device. So we are able, in principle, to make temperature images with MR. So what? What can we do with this? Well, it has been shown that the tissue alteration depends on the temperature level that that is exposed to, and also the time of exposure. In other words, we can define a thermal dose that can be related to the temperature change in time. And since we are able to make images, we are able in any pixel of the images to plot this curve and compute the accumulated thermal dose. So the principle of the advantage of MR thermometry is that you can acquire images of the temperature, that you can compute in real time the thermal dose images, and the purpose is to use this information as a clinical endpoint. Okay, so let's start with some examples of MR-guided HIFU treatments in the clinic. So this slide shows an example of a treatment of a uterine fibroid using a clinically approved MR-guided HIFU platform. So MR can be used not only for real-time thermometry, but it can be used to define the volume to treat, for the planning of the treatment. It can also be used for defining the safety margins. What are the regions I should take particularly care of avoiding to treat them. Then for each individual treatments or sonications, I'm going to make real-time MR thermometry and dosimetry to characterize what is the efficiency of the treatment I'm going to do at that location. So for example, in these two images, the images on the left, you show on the planned treatment that all the individual sonications are represented by a green circle, and for each of them I'm going to use MR thermometry in real time. Okay. Then, after completion of the treatment, I'm going to make post-ablation imaging to verify that the treatment that has just been performed while the patient is still on the table corresponds to the treatment planning. The advantage of MR, for example, can be also seen on the right. You can draw on the 3D images. You can represent the cone of propagation of the HIFU here in green, and you can then check that you are not going to send acoustic energy to a very sensitive structure, like for example the sciatic nerves. So in terms of safety, having a 3D MRI before ablation, while the patient is on the table, on the HIFU table, is an additional added value. So this is an example using another HIFU from Philips, the Sonalift system, where we can see, for example, in real time, the temperature distribution in a given location. If we now go to the brain, so it is well known this Insightec system that has been used for the treatment of essential tremor. So you can see, for example, in the bottom left and bottom right, the score of the patient before and after treatment, and you can see in the image in the middle that the lesion has been created in the brain. And you can use MR thermometry during treatment. However, due to technical constraints, for example, you can see the HIFU device in the magnet here. It's a huge device because you need to have a large aperture to sonicate through the bone, through the skull. Then you need to make compromise on the MR acquisition, and then you have to use the body coil of the MR systems, which intrinsically has much lower signal to noise and precision of thermometry as compared to dedicated head coils that are used, for example, in functional MRI. So this is illustrated here. If we could combine this HIFU system with a dedicated and optimized receiver coil system, we could, for example, do much MR thermometry. So this is an example using ecoplanar imaging, which is a fast method where you acquire a full case space in a few tenths of milliseconds. You can, for example, cover a full brain, well, let's say, for example, 20 slides every second or more with other acceleration techniques. And you can see here the magnitude images. We go from left and right through the brain of a volunteer. On the right, you get the corresponding phase images. And then you can compute, in this experiment that is done without any heating, of course, you can compute the temperature uncertainty using the standard deviation of the phase for each slice. And what you can see is that, you have the core scale on the right, is that most of the brain has a temperature uncertainty below 2 degrees, which is enough for monitoring precisely the treatment done with HIFU. But we have to take care, because even if we improve the hardware from the MR acquisition point of view, combined with the HIFU system, each time you want to accelerate the acquisition, you need to have a real-time image reconstruction, image processing, and display. And this must be done without any latency. In other words, you need to have this full processing to be faster than the acquisition rate. And for example, if you want to acquire 20 slices per second continuously, this means that you have no more than 50 milliseconds for image reconstruction, processing, and display. And this you have really to take care and define what is really useful and what is practically usable and feasible on a given hardware and software. So this brings me to this slide where you have a list of technical and practical constraints. So the important points in my point of view is what is the HIFU focal spot dimension? Are you going to make a single pot heating, or are you going to make a volumetric heating? In other words, this defines what should be ideally the ideal spatial resolution of your MR-thermometry sequence to avoid or to reduce the partial volume effect. What are the dimensions of the HIFU device and the material used? Are there impacts? Do they impact the stability of let's say the homogeneity of the magnetic field, or do we have to make compromise on the acquisition? How many receiver coils from the MR point of view can I use during the treatment? Is it a single coil? So if you use this, you cannot do, for example, parallel imaging. You need to have other methods. What are the performances of your gradient systems? And then what is the acquisition sequence? Is this going to be a 2D or 3D acquisition sequence? And for this, you need to have dedicated reconstruction and hardware and software. So you can, for example, look at these two publications where you have examples of 3D MR-thermometry in the brain. The other point is the stability in space and time of your static magnetic field B0, because if it varies during the acquisition because you are making dynamic images, then you may have difficulties in being able to have a reliable MR-thermometry. In other words, you need for each application to define what are the requirements in terms of spatial resolution and temporal resolution. Then, depending on your hardware and device, what will be your signal-to-noise ratio and uncertainty and temperature, and what is the heating protocol you're aiming to do.